Welcome back, everybody. You can tell you're not at a government meeting because the lunch is actually healthy. So that's how I knew we weren't at a government, 100% government-funded meeting. All right, we're going to start now because, as I said, we have a video conference presentation that's part of the panel. Yes, that's part of the panel, but you're going to do the introductions, right? Okay. I was just going to introduce the session and say that this session includes experiences and perspectives of mental health or violence, including stigma, victimization, and vulnerability, as well as media depictions of the relationship among and between these things. And Daniel Fisher from the Riverside Community Mental Health Center is going to be the lead of the panel and do the introduction. So I'll turn it over to.
Okay. Well, thank you very much, Peggy, and it's a pleasure to be here. Before I introduce the panelists, I'm going to say a few words about this topic. Our perspective is from that of a person with lived experience. That's the language we prefer. We don't like patient, we don't like consumer, you all don't like survivor, so we're people with lived experience, and you can fill in what the lived experience might be of mental health, of substance abuse, etc. I have been sitting here listening, gritting my teeth a bit as a person myself who has recovered from what's described as schizophrenia. I also was a biochemist at the National Institute of Mental Health. I have a PhD in biochemistry. I studied a lot of these pathways. And in fact, it was my biochemical studies that led me to the conclusion that we'll never find the answers in the laboratory. These are heavily overladen with people and personalities and culture and sense of self. That's why I left the laboratory and became a psychiatrist. And now I've left the psychiatric practice, more or less, to work in a broader scale, and that's really on the community-wide scale. So I feel at this point these are community-wide issues. They're not laboratory issues. They're not just clinical issues, but they do involve populations. And I've really been heartened by hearing a lot of the discussion here about culture. There are a few things as a person with lived experience I have to say, and that is I am sick of the media portraying us as the problem. That has to end. No other group would be treated this way. There's such a marginal increase in violence, and Harvey will go into that in much greater detail, marginal increase in violence among people labeled with mental illness, and yet it's portrayed and accepted by the media as a fact. And if we could do nothing else, if we could just bust that myth, that would help so much decrease stigma, decrease treatment. Nobody wants to go into treatment if they think that by being labeled and diagnosed, they were going to then be part of this group that was segregated and despised. The other thing I wanted to bring up is that there are other approaches besides the medical approach. I've heard an awful lot about, well, people should get into treatment, they should get their medication, maybe some therapy. There is an entire recovery movement that you all don't seem to have heard about yet. It's a recovery movement just like AA, and that is we with lived experience have made, I believe, and Ron Manderscheid said this before I said it, we have made the largest advancements in the mental health field in the last 20 years. That recovery is not only possible, but if you believe it and the people around you believe it, it will happen and does happen. And we're living evidence of it. We just don't like to go out and advertise it that much because of the stigma. We have a peer support program that is very viable all across the country. Thousands of people being trained, using lived experience and reducing the stigma by being side by side with other workers. And last thing, I couldn't resist saying a word about a program that we've developed at the National Empowerment Center, of which I'm executive director at this point, as long as Congress doesn't have its way. And that is something called emotional CPR, emotional CPR. And that is, I believe, a way to reduce the possible risk of violence, whether it's by someone labeled or not labeled. And many of these instances are people that haven't yet been labeled and don't want to be labeled. But if everybody, as many people as possible, could learn emotional CPR to connect, empower, and revitalize, another person. This is a general public health approach that we've developed from our own lived experience, and I think it has great promise. So, without further ado, I'm going to first start by introducing Ellen. Can you hear me, Ellen?
Yep, can you hear me?
I sure can. Can everybody hear Ellen? Okay, Ellen Sachs specialized in mental health law, criminal law, children in the law. Her recent research focused on ethical dimensions of psychiatric research and forced treatment of the mentally ill, people with mental illness. I don't know who wrote this. Professor Sachs was a 2009 recipient of a MacArthur Foundation Fellowship, and in fall of 2010 announced she is using funds from the Genius Grant to create the Sachs Institute for Mental Health Law, Policy, and Ethics. Her list of publications includes her 2007 memoir, The Center Cannot Hold: My Journey Through Madness, about her struggles and successes with schizophrenia and acute psychosis. Thank you very much for being here, at least by video. Go.
Thank you, Dan, very much. I